Clear aligners have established themselves as an effective and aesthetic option in modern orthodontics. Their clinical application requires not only biomechanical knowledge, but also precise planning and mastery of specific protocols for use. In practice, aligners allow sequential tooth movements to be controlled using removable splints manufactured with CAD/CAM technology. Each aligner must be worn for 7 to 10 days, generating micro movements that accumulate progressively. The treatment includes an active phase, a refinement phase, when necessary, and a retention phase. In addition, they are indicated for patients with mild to moderate malocclusions, crowding, diastemas, Class 1 with minimal discrepancies, overbites less than 4 millimeters, and mild open bites. They are also suitable for adolescents and adults with complete permanent dentition who are looking for an aesthetic and comfortable alternative to braces. They are not recommended in cases of severe malocclusions, rotations greater than 45 degrees, tooth loss without prosthetic planning, or uncooperative patients. Finally, clinical success with aligners depends on case selection, fidelity in the execution of the digital plan, and continuous patient follow-up. When used with technical rigor and appropriate diagnosis, they offer highly functional, aesthetic, and minimally invasive results.